Hey everybody, good morning. It's me, Megan Fox. I'm here. I don't have time for any introductions today. Let's just get right to it, shall we? We have been covering the Maya Kowalski case here as much as I can. And today it looks like a psychologist is on the stand. So we're going to go over there and get that started. And make sure you like and hit the subscribe button if you like this channel. And we are live right now on Locals, on Rumble, on YouTube, and on Facebook, I believe. So welcome to everyone watching at those platforms. Law and Crime. I can't even look at the comments in Law and Crimes over here where they have their live chat because it is nasty in there. I don't know if the hospital is paying trolls to just be anti-Maya Kowalski's family, but they're in there accusing a child of lying and manipulating, and it's just gross. I don't know what's going on with the commenters in the Law and Crime chat, but I've heard some really terrible things before, but probably not so many terrible things as I've heard about this family. And it's really gross, so I'm not going to pay any attention to it. All right, so here we go. I'm going to set this up. I'm going to play at 1.25 speed, and I'll probably take off and go to the kitchen and make sure and maybe empty the dishwasher, but I'll be right back. Don't worry. I do have things to do, but let's watch this together.
Good morning. Please state your name for the record.
Timothy David Brewerton.
And you are a doctor of both adult and pediatric psychiatry.
Yes.
And you also participate in forensic review of issues involving adult and pediatric psychiatry.
Yes.
And have you been asked here to offer opinions regarding the circumstances surrounding the treatment by Maya Kowalski at Johns Hopkins Children's Hospital and the resulting effects in terms of psychiatric, psychological disorders and the prognosis?
Yes, I have.
I'd like to give the jury the benefit so they understand from whence your opinions come, of your background, training, experience towards offering these opinions. If we can start with your undergraduate degree, give the jury a brief summary of your scholastics.
Okay. I'm from Baton Rouge, Louisiana, and I went to LSU undergraduate and I majored in zoology with a minor in psychology. From there, I went to Tulane Medical School in New Orleans. I knew that I wanted to become a psychiatrist, so I took a lot of psychiatry and neurology when I was in medical school. And then I went to the University of California in San Francisco for my internship and psychiatric residency. The research bug kind of bit me at that point, and I applied to a fellowship at National Institute of Mental Health, where I was doing psychopharmacologic work with eating disorder patients.
Nobody really cares about the background.
Psychopharmacology is basically drugs that affect the brain and the psyche.
We're going to go faster through
studied in
this.
particular the serotonin system and other systems and their involvement in mental illness. Before that, I worked at Hawaii State Hospital as a public health service payback. From the National Institute of Mental Health, I took a faculty position at the Medical University of South Carolina in Charleston, where I have been a professor ever since. During my
Cindy, stop it!
Very shortly after starting at the Medical University of South Carolina,
don't get me going.
Basically, because of some of the patients that I saw, I subsequently went back
give
to
it a whirl.
Professor, a child and adolescent psychiatry fellowship in 1994 to 96. Following that, I studied forensic psychiatry and I got board certified in forensic psychiatry. And then later on,
if you guys missed Legal Vices sidebars, you won't understand
general
that.
Psychiatry, child adolescent psychiatry.
But if you do watch the sidebars and you missed today, you might want to go back.
South Carolina, and I'm also licensed as a medical doctor expert witness in Florida.
All right. And have you published papers in these areas that may be of significance in your evaluation of the Kowalskis in this circumstance?
Yes, I have. I've published approximately 185 peer-reviewed articles and book chapters, reviews, and many of those are in the realm of comorbid psychiatric disorders, including mood disorders, anxiety disorders, substance use disorders. My particular interest has been in post-traumatic stress disorder.
And
I'm editor of 2 books. I've presented at a lot of international meetings and have been very academically oriented, but I'm a clinician who also does research.
And tell us about your hospital privileges and where you have practiced in the hospital setting of your career.
Sure. I worked moonlighting when I was a resident in Sacramento, California. I've been a staff psychiatrist at Highland General in Oakland. I worked for the U.S. Public Health Service at Hawaii State Hospital. I worked at the National Institute of Mental Health as a medical staff fellow, and privileges there. I was a director of the Eating Disorder Program and attending psychiatrist at the Medical University of South Carolina Institute of Psychiatry. I worked on the consultation liaison service there initially. I've been a consultant to the National Crime Victims Research and Treatment Center, and that's where I learned a lot about trauma and its effects and PTSD and other trauma-related disorders. Then I've been a consultant at a number of eating disorder facilities, higher levels of care, possibly people are familiar with residential care centers. So I consulted with a number of residential treatment centers, Rosewood, Rivermend, Eating Recovery Center and Pathlight programs, Montanito and affiliates that has over 40 sites across the country in 13 states. I was director of clinical outcomes and research for Montanito. So I was executive medical director at the Hearth Center for Eating Disorders in Columbia, South Carolina. So I've had a lot of varied experience in my career.
How long have you been in practice?
Well, let's see, I got my degree in 1978, my MD, and I completed my residency in 1982, and that's when I became board certified in general psychiatry. But I've had a license to practice medicine since 1978.
And over this period of time, particularly after you developed a subspecialty in child abuse, can you give the jury some idea of the number of pediatric child abuse victims patients that you've had the opportunity to evaluate and or study?
Hundreds. I've seen hundreds of patients, and unfortunately, child trauma is extremely common. And so I can't give you an exact number, but it's certainly in the hundreds.
All right. And you live in Charleston, South
I do.
Carolina?
I live in Charleston County, South Carolina.
So what did you understand your assignment to be when you were retained by our firm to evaluate this case?
To first off, look at the records and also evaluate Maya and her family in terms of their psychiatric status diagnostically, and to give an overview of what my opinion was in terms of their psychiatric status, and to comment about the events that led up to the current problems that she's having.
And as part of that, did you also evaluate Kyle and Jack?
Yes, I did.
Kowalski?
Yes, I did.
And it was part of your assignment to evaluate the prognosis for this family, and in particular Maya Kowalski.
That's right. In addition to making a diagnostic assessment and diagnoses based on the records, as well as very careful structured interviews of Maya and her family, to comment about the implications of those findings long-term, including the prognosis and possible long-term effects to the extent that one can anticipate.
Tell the jury then how you went about this. Was this a 3-step program, 2-step program? And I'm specifically orienting you towards the review of the record, and then the investigation, if you will, and evaluation of the Kowalskis themselves.
Well, it started with getting the voluminous amount of medical records, not only from Johns Hopkins All Children's, but all of the places that we had available records for Maya. And looking at those, and they're literally thousands of pages, and going through those and kind of determining, her course, her historical medical psychiatric course, and then arranging for Maya and her family to complete some self-report measures. I'm very, I try to be as objective as I possibly can when I make evaluations for forensic purposes. And so I use a lot of validated instruments that are in the literature to measure things like depression, anxiety, PTSD, quality of life, ADHD, and so forth. I don't just rely on asking questions. I ask them to complete the self-reports. And then I come back with, after that, and I do what's called a structured interview. These are structured interviews. They're a list of set questions that I go through kind of systematically with the parent when you have a child that you're evaluating, because often the parent has a very different perspective about how the child is doing. And then I also do the same kind of thing with the child or adolescent. So it's a very comprehensive, it takes several hours to do these kinds of evaluations.
And during 2022, your scope of evaluations for this case, how many times did you meet with one of the Kowalskis in order to gather the information necessary?
The initial examination took place over 3 days, January 20th, the 24th, and the 30th of 2022. I had some email contact with them through your office in terms of sending them the self-report instruments that I wanted them to complete, so that when I did meet with them, we could go over them.
And have you kept in touch with the Kowalskis since that time?
Yes, I have.
So let's go over then briefly your findings in terms of the psychological testing. And maybe we should go over, if you would like, anything out of the records that were provided to you that was significant leading up to the testing and evaluation.
Sure. I think, my opinion is based on the records and the interview and my history in the entirety of my assessment, right? And so basically the bottom line is what I found and what I think is that there was a misdiagnosis of Munchausen's by proxy and factitious disorder. Those require
We're objecting already? Oh, that white noise is tough. Normally Law and Crime mutes it, but they didn't, so I'm going to, because I don't want to listen to that. I wasn't really paying attention to exactly what he was saying that would have been objected to, so I didn't hear what that objection was. Did they turn the mics off yet? Yeah, they did. Okay. All right. For those of you just joining, this is the Maya Kowalski trial. A quick rundown if you want to read about it. There's a linked article in the description of this video. No matter where you're watching, you should be able to find it. You can go and read a recap, but basically Maya Kowalski was a 10-year-old little girl with a very rare pain disorder. And Johns Hopkins All Children's Hospital in Florida accused her mother of having Munchausen syndrome by proxy. They claimed she didn't have this disease. They claimed that she was making it up. They sent her for psychological services. They did not offer her treatment for CRPS. There were nurses keeping her hostage in a hospital. She claims that they abused her while she was there. They wouldn't help her go to the bathroom, all kinds of terrible things. And they're suing Johns Hopkins. And her mother was driven to self-deletion through this process. The court took away her child, wouldn't let her hug her child, wouldn't let her be with her sick child. And the hospital was involved in this. It was the hospital's the one that did it in the first place. They never got the diagnosis properly. Oh, they objected to misdiagnosis. Well, that's exactly what they did. Exactly what they did was miss the diagnosis, but they're still trying to say she made it up. AP sends a $5 super chat for let's give it a whirl. And if you don't know what that's about, you're going to have to go watch Johnny Depp's sidebars on Legal Vices from earlier today, because it was really ridiculously crazy. Really, really stupid. Give it a whirl. We found out today was something that Elaine Brederhoft actually said during a sidebar.
Let's talk about the testing that you did on the Kowalskis and the history that you took from them, given the parameters we discussed.
You want me to go through each test?
Yes, briefly.
Okay.
Just so the jury has an idea of what was significant here.
Okay. So the parent-reported instruments that I asked Jack to complete on both Maya and Kyle included the UCLA PTSD Reaction Index for DSM-5, the Child Depression Inventory parent version, the Vanderbilt ADHD Diagnostic Parent Rating Scale, the Multidimensional Anxiety Scale for Children, second edition parent report, the Screen for Child Anxiety-Related Disorders, the parent version, the Child Dissociative Checklist, and the Pediatric Quality of Life Inventory, parent report for teens.
And what are those designed to do?
Those are designed to assess for PTSD, ADHD, depression, anxiety disorders, an array of different types of anxiety disorders, dissociation, and quality of life, which all mental illness, all mental disorders require some sort of disturbance or impairment in life, in quality of life, to make a problem a disorder. In addition, I gave self-assessment instruments to both Maya and Kyle, including the life events checklist for the DSM-5, which measures traumatic events, gets their subjective report of what was traumatic to them. the PTSD symptom checklist for DSM-5, which is an assessment of PTSD symptoms according to our diagnostic criteria, the multidimensional anxiety scale for children, the screen for child or anxiety-related disorders, the youth version, the child depression inventory, the child adolescent perfectionism scale. And I also gave to Maya and Kyle the traumatic grief inventory self-report, which measures persistent complicated bereavement given the situation with their mother. I also gave Maya the adolescent pediatric pain tool as a general assessment of her pain level and where she was experiencing pain at that time. And if you want me to go ahead and talk about findings.
Yes. Now that let me ask you, are those tests generally accepted within the psychiatric medical community as the best measures, indications of the psychological status of the patient?
Yes, they're all highly reliable and validated, is what we say in statistics and clinical research. They've been tested and documented to really assess what they're meant to assess.
And are there built-in safeguards against manipulation or an attempt to produce a result, a foregone conclusion, if you will?
They can possibly be manipulated. That is true. And so, but there are some ways that you can get around that or see the consistency. Part of why I gave them so many, if you notice, some of them were measuring the same thing from a different angle. So depending on how you ask a question, and if you get different answers, that can be a tip off to some manipulation.
And do you then check the results against your interviews to determine
exactly,
whether they're
yes.
Inherent?
That's right. You check for the consistency between the self-report and the interview and just the whole historical narrative and also the records.
And so what was significant about the history insofar as what was told to or what the Kowalskis were informed of the treatment of Maya while she was in the hospital?
Would you repeat that, please?
Sure. I'll tell you what, I think that question is premature. Well, let's go over the results of the examination.
Okay. So it was very strong evidence that Maya is suffering from post-traumatic stress disorder chronically ever since she got out of Hopkins. She also has recurrent major depressive disorder of moderate severity. She also had persistent, complicated traumatic bereavement. Everyone understands grief. It's a part of humanity. We all have loss and deal with that. But sometimes it can be complicated and prolonged and problematic. And that's the case. And, there's also the issue of misdiagnosis, which I'm not sure if I can talk about. Because there are some things that I found. And then there are some things.
Sorry, we need to get to the next question.
Yes, sir. So let's go over just the basic then diagnoses of Kyle and Jack Kowalski, and then we'll come back to the consequences and sequelae.
Okay. This was a trauma for everyone, especially Maya, but also Kyle and also Jack. And all of the family had met criteria for major depressive disorder and post-traumatic stress disorder and persistent complicated bereavement.
What happens when all three members of a family are suffering from these disorders concurrently? What are the effects on the family dynamics?
Well, they're not really able to be a support to each other. If they're all impaired and they're all suffering, people often get by with a little help from our friends, right? And from our families. And so family member support is enormously important in dealing with and coping with and recovering from traumas like this, but mental disorders and medical disorders, regardless, family support is enormously important. And so if everyone is suffering and kind of in the same hole, it makes it much harder to get out of that hole.
So Maya going in, the baseline for Maya going into this episode with Johns Hopkins, with her CRPS, how did you distinguish the symptoms and issues from the CRPS from the psychological problems that you found through the testing and interviewing process?
I reviewed the literature extensively. I probably read over 100 papers in this case, various aspects of it. And one important area of the literature is...
Just tell us what the overall view you have as a result of your investigations.
There's a tremendous overlap in symptomatology between complex regional pain syndrome in certain psychiatric disorders. And it is often confused with conversion disorder. There's an enormous literature about that. I can't talk about the literature. Okay. There's an enormous confusion between complex regional pain syndrome, given the symptomatology, because it doesn't, it's a relatively newer disorder. First, it was called reflex sympathetic dystrophy, and they thought it was a overreaction of the sympathetic nervous system, and that's how it got that name, a small injury with a dramatic response that seemed out of proportion to the initial injury. And so that's why they call it sympathetic dystrophy. But they realized that the sympathetic nervous system alone was not the only thing involved in complex regional pain syndrome. It really involves not only the autonomic or peripheral nervous system, but the central nervous system as well. And there have been a number of studies and alterations found in brain scans and other physiological measures, neurophysiological measures in people with complex regional pain syndrome. They often have psychiatric symptoms and depression. And this is true just in the pain literature in general, in the medical literature in general. When you are suffering with enormous pain, and we've already heard that the McGill pain, on the McGill pain scale, CRPS has some of the worst pain known to man. It's at the top of the scale in terms of what it can produce pain-wise. So
my question,
people suffer enormously.
My next question was how did that pain influence these?
That's my next statement. Yeah.
I have to ask questions every once in a while.
So when people are suffering with that kind of pain, it leads to psychological reactions, understandably. I mean, it's not rocket science, right? That you might get super anxious and depressed and stressed. And a lot of psychiatric disorders have in common the activation of the stress axis. We have a stress system in our bodies and in our brains and part of it is the sympathetic nervous system, the fight or flight that you've heard of, certainly. But there's a whole endocrine response or hormonal response that starts in the brain that releases tremendous amounts of cortisol put out by the adrenal glands to help us deal with stress. And this has a kind of a domino effect in the brain in terms of other neurotransmitters, neuroendocrine systems, and hormonal systems, peptide systems. Just the neurochemicals in the brain are downstream affected in a major way, and the receptors through which neurons communicate with each other, and the production of inflammation. And inflammation is a very common mechanism we've heard across neurological and psychiatric and medical disorders. And this notion that brain and mind or body and mind are separate is really a myth, because we're one organism, and we have mental aspects and we have physical aspects, and they're really inseparable. And when you have physical disorders, particularly those that affect the brain, you typically have psychological disorders as well, or reactions or symptoms. Very, very, very common. And so there's an enormous confusion often about, particularly when you can't pinpoint to the lesion or the problem in the brain, which neurologists have traditionally tried to do. Well, the stroke is here in this part of the brain, and it's producing these symptoms, and it's predictable. With CRPS, we're still learning. Science, medicine, psychiatry, neurology is an evolving field, constantly evolving. There are literally hundreds of articles published every day that have to do with mental illness, neurological disorders.
I'll ask another question. All right. So when you've got this overlay of inflammation and the pain responses, does it exacerbate the diagnoses that you made of the psychological disorders?
Yes.
And so in doing so, does it amplify the effects, practical effects on the patient?
Yes. And often to treat the mental part, you have to treat the physical part effectively. You don't just compartmentalize it and say, I'm just going to do this piece of it. You treat the whole patient, right? And so in order to deal with the depression, you have to deal effectively with the pain and the source of the pain, right? And vice versa.
And so in this instance, with Maya being diagnosed, let's talk about the effects of the accusations of Munchausen by proxy on this family in terms of producing these psychological disorders.
When people come to a tertiary care center, in the emergency room of a tertiary care center, they are not their best self at that time, at that moment. They are tremendously dependent, helpless, needy. They're in desperation.
This is not responsive to the question.
It's getting there.
Let's get there.
Okay. If we can, as succinctly as we can, state how the idea that that wife and mother might be somehow is being accused of actually harming them. How did that affect them psychologically in terms of developing these disorders?
So they're not getting their needs met appropriately. They're being actually accused of.
Your Honor, maybe a question.
I'm back. Hold on. I'm coming. Jeff, I'm going to send you a link in a second. Hold on. I was just heating up my food. I'm back. Hold on. Oh, wait. All right. So, Johns Hopkins is desperate to keep this guy from basically telling everyone what they did and what they caused. And it's really interesting to me because CPS, DCF, and all these hospitals that accuse mothers of harming their own children actually end up harming the children they say they're helping. And in this case, they gave her PTSD. Do you know how many people I have that I know who have PTSD from what DCF did to them or what the family court system did to them? They actually got PTSD from the system. And so you've got a hospital here who claims they're helping a child, and all they end up doing is giving the entire family complex PTSD. They don't want this guy to testify at all. And frankly, I don't know why he should be stopped. If this is what happened, this is what happened. I'm going to go send Jeff a link. I think he might join me. I thought he was dying from that give it a whirl shot that he did, which was horrific. All right, here we go. There you go, Jeff. Hefe, come on in. Mm-hmm. All right. All right, so they're still up there. And I was going to eat my lunch. It's all hot and waiting here for me to eat, and now I have to fill the time. Oh, no, I don't. I can fast forward. I forgot. We're not watching this live. Let's move it right along, shall we?
Objection's the same.
There we go. Now I can eat.
Let's stick with Maya. What was the effect on Maya of this diagnosis against her mother? That's
I will allow that question.
Devastating.
Actually, I'll say it. Let's sustain because of the word diagnosis. That's
the result.
question.
So he's going to allow it,
What
and then he
was the
sustains it
effect on
because he didn't
Maya
like the answer? What the
of-
hell?
The accusations against her mother of Munchausen by proxy.
Single objection. We'll allow that.
Confusion, disbelief, devastation, feeling misunderstood, blamed, victimized, shamed, increase in stress rather than decreasing pain and stress, increasing stress and pain of a psychological and physical nature.
And insofar as how it related to your diagnoses of depression and post-traumatic stress disorder, was this part of the cause there?
Yes.
And so now, as
Hefe, you're here.
I want to talk a little bit about the prognosis here on Maya, given what you understand about the diagnosis of CRPS and how it's going to interact in the future with your diagnosis of PTSD and chronic depression.
Okay. So Maya has evidence of 3 very chronic illnesses. CRPS, which tends to be lifelong, as you heard from Dr. Chopra. Recurrent major depressive disorder. And this is at least the second or third severe episode.
I haven't heard that one yet.
She's had at least 2 or 3. And we know that a lot of people don't understand this, but major depression is a brain disorder. It's one of the most disabling conditions on the planet. And we know that as it gets worse and more recurrent, Each subsequent episode is harder and harder to treat. It gets more and more severe. There's something that it does to the brain in terms of making a groove in the brain so that it becomes more and more treatment refractory with time. And the same is true for PTSD. And when you have this kind of comorbidity just meaning multiple disorders, particularly when you have a chronic pain-related disorder, that makes the psychiatric component tend to be more severe and harder to treat because you have to treat the pain disorder effectively to treat the mental disorder as well. PTSD tends to be a chronic disorder. Studies shown 20 years later, 40% of people still have the full diagnosis of PTSD. This is big studies done by the World Health Organization. So there have been a number of long-term studies of PTSD showing that it tends to be a chronic disorder. And Maya has already had PTSD now for 6.5 years. And so
what does that indicate now that she's had it consistently through this period of time?
It indicates that it's not something that just goes away with no treatment. And sometimes with treatment, sometimes with the best treatment, it doesn't go away. And even when you don't meet full criteria, people often have subclinical evidence of PTSD. They don't meet the full criteria, but they meet a lot of the criteria. And so 40% may have full criteria, but then there's several tens of percent that have significant partial criteria that they're continuing to suffer with. So most people don't completely recover where they don't have any symptoms. And so when you combine all of these, the CRP, the complex regional pain syndrome, the recurrent major depression, and the PTSD, and most people with PTSD also have depression. And it makes it harder to treat. So it makes for a very guarded and negative long-term prognosis.
How does the avoidance strike you? Did you find that as part of your evaluation that Maya first had developed any avoidance techniques or problems?
Yeah.
Better way to put it.
So there are 4 major clusters of symptoms in PTSD.
And I'm going to then ask you to bring those back.
And so avoidance is one of them. And avoidance of any reminders of the trauma. And we've already heard from Maya that she avoids doctors. And that was really crystal clear in my evaluation of Maya and her family. She doesn't want to get anywhere near a medical professional, even though at some level, cognitively, logically, she knows that she could probably need it, but she's not about to do it because of the fear, the intense avoidance that is part and parcel of PTSD, along with the hyperarousal, the anxiety, the intrusive images, the flashbacks, the nightmares, the sleeplessness. There's a whole host of symptoms. A lot of people think that this is just something that happens to combat veterans. No, it happens in civil life with civil interpersonal traumas all the time, especially interpersonal traumas.
Did you document those symptoms in Maya Kowalski?
I did, yes, in spades.
And what were the test results that brought that out, or the interview process that brought that out?
The instruments that I named earlier that measure PTSD symptoms that were endorsed by not only Maya herself, but also by Jack, and then also doing structured interview, which is the highest gold standard of diagnosing PTSD, is where you do a structured interview using one of these reliable instruments. And I use the Kitty SADS, which is the Schedule for Affective Disorders and Schizophrenia. It's a common structured interview used in children in research and clinical settings to make sure that you get the correct diagnosis. It has very high reliability. So
what were some of the things that Maya developed an avoidance of as a result of her experience?
So I'm just saying that you got 2 self-reports, Maya's self-report, Jack's self-report, and structured interview of Maya and structured interview of her father, Jack, and all of them confirm PTSD is what I'm saying. Plus, there was a diagnosis made prior by Rebecca Johnson and also by the psychiatrist that subsequently saw her after, and who did not have, who was not privy to my notes, who diagnosed her with PTSD, Dr. Henschke. So
Yeah.
what symptoms did she have?
Yes, we'll give them the jury some examples of the avoidance that you documented. She got it.
Okay. For example, not wanting to go anywhere near St. Petersburg, where Johns Hopkins is located, not wanting to go in that direction, not going anywhere near the hospital, not going to any doctors. And Maya has, chronic conditions and she needs medical care. Her best chances of having a better outcome are getting evidence-based treatment for all of the conditions that she has. But she's loath to do that because of the fear that has been that has a result of her PTSD and her experiences.
But doctor, she has been to say a dermatologist and to a dentist over the course of this. How does
There
that
are some
factor in?
there are some things that are much less threatening than others. A dentist is not going to keep you in his office.
Right.
And there are certain people that she had to see just to maintain a minimum of her health. And she already had a relationship with her family physician, Dr. Wazenar, for example. He is one of the more trusted people, but she still doesn't like it, and it still may elicit intrusive imagery of her traumas.
Now, the future for her in light of this avoidance, what does that portend for her ability to recover from episodes of any one of these, depression or severe PTSD?
So have they talked a lot about her
Serious,
depression? This is like the first time I'm hearing that she has this.
Well, she's better, but she hasn't fully
No.
recovered. And so it's a negative prognosis. And
No, but I think that that's what his testimony is here to do. They didn't really ask Maya on the stand, like, what are you suffering because of this? I think they're going to introduce that through the experts, I would guess, because it's probably hard for her to talk about. I don't know.
Yeah.
I don't know,
was
but
curious.
yeah.
I hadn't heard that yet.
Well, I would imagine that you'd get depressed after
Well,
losing
yeah.
your mother like this.
Well, and then going through all that shit that she went through forever.
Watch Johns Hopkins now try to make it sound like her mother gave her PTSD and depressive disorder. That's coming.
so we know we've learned a tremendous amount in the last 30 years about the role that trauma plays in general. Some people may have heard of the adverse childhood experiences scale, and there are hundreds of articles now about the effects of adverse childhood experiences on all of the major medical disorders that people die from. We're not just talking about psychiatric disorders. We're talking about it being a validated risk factor
Thanks,
for
Duncan.
the development of cardiac
Appreciate that.
Woohoo!
And your impulsive
and
spending.
autoimmune
I'm all
disorders,
for it.
and neurological disorders, and substance use disorders, and suicide, and certainly depression, a certain degree of eating disorders, and so there's a host of psychiatric and medical disorders that we know are higher in people
Oh,
who've
not
had
the
childhood
porn
trauma.
bots
And
again.
this is not.
Yeah.
Do we have any mods in chat?
To ask a question.
Well, I don't know if you'd make me one.
And
So the
we would.
prognosis is
You're
negative.
not a mod?
Apparently
what I
not.
was-
Answer his question.
That's weird. Now you
I
go.
was speaking more of when Maya has these problems in the future, her avoidance of, say, a hospital ER or, intensive care unit or anything associated with what went on to her. How is that going to affect her ability to recover from these episodes?
Overall, you can answer that question.
It's going to likely negatively impact it if she doesn't pursue getting the proper care at the proper
Nope,
time.
I'm not a mod.
And
Shame
on
continue
you,
to avoid it.
I will fix it.
Now, will with in my
Because you're whining.
circumstance, the process of aging and more responsibilities in her life, how will this affect
There you
her
go.
ability to deal with those?
I'll just
Or
put some Epsom
respond to
salts on
those,
my butt hurt.
in terms of overcoming these.
It's not letting me
Problem.
save.
Yeah. Does life get easier as we get older? I don't think
Weird.
so. I think it continues to become challenging at every point. And, Maya is now still in her family's home, in her father and brother's home, but she's about to go out into the world, presumably.
It's
and
weird. It's not
eventually
letting
leave
me
home.
make you a
And so
moderator.
life will present any number of challenges and potential stressors and traumas. And
Probably
trauma is
blocked me.
ubiquitous. And so it's likely
did
that
not
she
block you.
will sustain other major
I'll try it
challenges
from my
that will
phone.
likely compromise her psychologically and medically.
Doctor, I want you to assume for the purposes of this question that even at her position right now, finishing school, she still has not retaken her SATs anytime in the past 5 years.
There, that
She
worked.
has not applied to any colleges. She has not pursued any further work or consistent hobbies,
Right.
or any real plans for what's next. Do you have an opinion based upon your background, training, and experience, and to a reasonable medical probability if these facts indicate that Maya will have problems in the future?
Objection, mischaracterization, misinformation, foundation, and speculation.
Overall, you can answer.
Maya leads a fairly sheltered and alone life, and she's withdrawn from the world. She's
Yeah,
not
because
as
of the
active and
friggin'
out in the
hospital.
world as she once was
Mhm.
prior to these events. And so and one of the things that we know that happens with PTSD is that
Doesn't go to church
people don't
anymore.
have much hope. They have less hope for the future. Uh, they often think that they're going to die young. They often think that the life doesn't really hold.
Why
much
isn't
in store for them.
Johns
They
Hopkins
often
asking
have
the
what
most
is called
important
anhedonia,
question?
and they don't.
How many
they don't,
zeros do we
experience
put on
pleasure,
this check?
like many of us do, just with the regular simple things in life. So there's a bluntedness and a numbing and a negativity that is kind of cast over one's overview.
Hold on, the chat needs advice. You got the
Epsom
Rona?
salt.
Have some salts. No, you got the Rona and your body aches and you have a migraine that kills. What to do? Okay. So both times that I had COVID, it was weird because both times were different. And one time ice worked on all the aches and pains. And the second time only heat worked. So my advice is try ice or heat. If ice doesn't work, try heat. And if heat doesn't work, try ice. And if neither works, well, you're fucked. I'm sorry. COVID sucks.
You got
Epsom
the
salt's
hot Rona
different.
or the cold Rona?
Oh, I'm sorry. I hope you get better soon. Oh, and also, you might want to ask your doctor for some
Vaccines?
steroid nasal
Oh.
spray so you don't get a sinus infection afterwards, because that's bad too. Yeah. Flux says, yeah, Epsom salts will work for that.
View of life going forward.
Did you diagnose allodonia in Maya to any degree?
She reported it. I didn't examine her physically, but she certainly reported it, and it's throughout the records.
Do you have an opinion based upon your background, training, and experience into a reasonable medical probability as to whether Maya Kowalski sustained post-traumatic stress disorder from the events at Johns Hopkins All Children's Hospital?
I do, absolutely, unquestionable. She did.
Do you have an opinion based upon your background, training, and experience into a reasonable medical psychological probability as to whether Maya Kowalski sustained major depressive disorder as a result of her experience at Johns Hopkins All Children's Hospital?
I do. It was made worse and more persistent, and with the advent or addition of PTSD, it was made more relatively harder to treat and more likely treatment refractory. She did have some milder depressive symptoms going into her admission to Hopkins, and it was getting better. When
Sure, she was chronically
being admitted
ill.
because her CRPS was getting better at that time. And then afterwards, though, she had much more severe retracted depressive symptoms. And then she had a relapse in 2020, which was right around the same time that she was in Hopkins, by the way, in November. And people often have anniversary reactions that trigger memories, they trigger depression. It's no accident, I think, that this happened in November and she had been admitted in October 4 years earlier.
Did it come to your attention that at least two of Maya Kowalski's CRPS relapses were triggered by psychological factors?
Yes.
And my question is then, how will Maya be able to know which psychological factors as she gets older will put her back into a CRPS relapse or a state of depression that limits her ability to function in the world?
Objection, speculation. Overruled.
So what can help her deal with that? I think psychotherapy could help her deal with that, to become more self-aware and harm avoidant.
So far, she's not indicated a lot of desire to go back to psychotherapy.
Definitely not.
And did you discover through your investigation why?
Yes. I think I've talked about how, she doesn't want to get anywhere near a white coat or anybody in the medical profession. And because it elicits intrusive imagery, it elicits hyperarousal, fear, anxiety, depression. It brings back memories of her stay there, of her mother, the loss, the whole 9 yards.
And do you have an opinion based upon your background, training, experience to a reasonable medical probability as to whether the psychological, psychiatric disorders you have diagnosed Maya Kowalski with will substantially impact her ability to earn money in the future, that is, diminish her earning capacity?
Yes, there's clear evidence that these kinds of disorders, particularly the combination that I've mentioned, definitely influences one's earning capacity down the road.
In terms of the prognosis that you have given us, can you give the jury some idea, although they'll hear it from Dr. Bifulco and others later, but can you give the jury an idea of, if we could get Maya to do it, what would be your recommendation as to the appropriate care?
Okay. Well, I think she needs to be in psychotherapy, as I've mentioned.
How often and at what periods?
And I think with this is really an example of complex trauma, meaning that this is not just one incident, one single isolated incident. This is a host of events that occurred to her that make, on top of having a chronic, terribly painful illness, and on top of losing her mother and having less support. So all of that together makes her trauma complex. And so it makes her treatment more long-term, and her needing more long-term psychotherapy and more regular
Can
psychotherapy,
you give us some,
once or twice a week.
Okay. Quantitative
Indefinitely.
factors is what I'm looking for.
Yeah, and
Once or twice
usually
a
psychiatrists,
week,
some
indefinitely.
psychiatrists will do
Holy
psychotherapy.
shit.
Most are
Eh,
focusing on medication management these days. But so if that's the case and she's seeing another psychotherapist separate from the psychiatrist will need to see her at least monthly in addition to her psychotherapy. And she's also, needs antidepressant medications, in my opinion, which can help not only the depression, but also the PTSD.
And how often will
The
she?
combination
I don't
of
know
the
if I agree
psychopharmacology
with that.
and the psychotherapy can also often be effective in at least significantly attenuating or dampening
Those
the
drugs are
symptoms that
scary.
we're talking about.
All right, the 1 to 2 weeks psychotherapy. First, again, this all assumes we get Maya there to do it.
Right.
But for what period of time, if we were to get her to do it starting in a month, how long would you expect to a reasonable psychological probability she would need to get her to the best place she can be? And my next question will be, then when she has breakouts, we want to call them, how long?
Well, it's really
congratulations,
impossible to know
Flux.
when and if she will respond.
Oh,
And I
Flux
think
is the new auntie.
the answer really is, and not to
Aw.
be flippant, but the answer is she needs it as long
Oh,
as she
I love
needs it.
anteaters.
And that could be indefinitely.
Oh, wait, I read
And
that
so
wrong.
it depends on how she does over time. And also psychotherapy and treatment,
Congrats,
psychiatric,
Flux.
psychological treatment, mental health treatment is a collaborative endeavor, right? So she will decide to what extent it's helping, to what extent she needs to continue it. It's not something that's mandated, and we want to stay away from mandating anything with Maya. It needs to be focused on establishing trust and an alliance.
Yeah.
It's going to be slow.
Don't tell Maya what to do ever
reestablish that,
again.
with someone who can see her more long term and who can kind of look at the big picture, not only her psychiatric issues, but her medical and neurological issues as well.
You had testified previously that now the psychiatrists are involved more in the pharmacology, the writing.
Yes.
So to properly maintain her on the medications and adjust as necessary, approximately how often will she need to see a psychiatrist for those medical psychological issues?
He said
Well, she's
once a
had 2
month.
or 3 episodes of major depression, has chronic PTSD, plus the CRPS, plus dealing with the bereavement. We know that when people have 3 separate episodes of major depression, they essentially need to be on antidepressant medications for life. If you had 1 episode, the chances of the next episode are 50-50. If you've had 2 episodes, the chances of another episode, no matter what you do to avoid it, are 95%. I'm sorry, if you've had 2, it's 75%. If you've had 3, it's 95%. So once you've had 3 separate episodes, you pretty much need to treat people for life. And antidepressants, by and large, that may sound horrible, but antidepressants actually are very effective in a lot of people, and they have relatively minor side effects compared to the benefits that people can receive from them. Now, many people don't respond to the first antidepressant or the second antidepressant, and often it's a trial and error kind of process. And now, if you don't respond to that, or you don't get a full response to that, there are other emerging treatments that are available, like transcranial magnetic stimulation or RTMS. And so that's a FDA-approved treatment for treatment refractory depression. And there are other. Actually, we know ketamine is now a treatment very common around the country and in the world for treatment refractory depression. It's ironic.
Ketamine. Let's give her some more ketamine. Like, who's going to give it to her?
Once a year, twice a year?
How often for what?
To see a psychiatrist to adjust her meds.
At least once a month.
Probably
if not sooner.
traumatized
If you're
by
starting
that
a new medicine,
anyway.
it probably needs to be more frequent, every week or two. When you're having change, when she's more stable, then at least once a month.
And how long will that last?
I would say indefinitely.
Once every 6 months, once a year.
I think given her history.
The chat, Duncan Idaho, thanks for the super chat, said, let's give her some time to get better situationally, get some distance from all this before we put her on the antidepressants. I mean, we're not doctors here, but yeah, we've all seen what antidepressants do to the population, haven't we? But that's okay. I'm not handing out medical advice. I just think maybe this big pharma pitch here is not not great. But anyway, his other testimony is fine, I think. Jeff, what do you
Well,
think?
ketamine was doing good. That's what started the whole thing in Mexico, wasn't it? Like ketamine was
Yes.
actually working. So.
And I knew they were going to bring, I knew he was going to bring up ketamine because ketamine is being used for depression and having really good results, you know, basically curing people of depression. So do hallucinogens like LSD, psilocybin, all these. So of course, now though, this is the same argument. It's like, oh, so all these big pharma drugs that people have been taking don't really work that well. But what does work well? Oh, mushrooms. Shit. You know, we've been they didn't let us, we started experimenting with that in the 60s, and then the CIA took over and everything became illegal. You're not allowed to have LSD, you're not allowed to have these things. Now it's 2023 and people are experimenting again and saying no, it's really curing people of alcoholism, depression, all kinds of things. But yeah, she's not the one she's not the kind of patient now who's going to want to try anything like that, is she? Because she's been terrified and terrorized for trying alternative therapies like ketamine. So, yeah. So she's stuck.
And given the number of episodes that she's had already, it's likely that she'll need that for life. More likely than not.
And in your opinion, based upon your background, training, and experience of these,
Mexican Vader. I stopped myself
solution
from going there.
The causation of what she experienced.
But you felt me.
Absolutely. Very clearly. She didn't have PTSD before she went to Hopkins.
So now let's talk for a second about Maya seems to look okay outwardly.
Yep.
And she testified before the jury here. Some emotion, as you may have seen. And were you able to watch her?
Yes, I was in the courtroom yesterday watching her.
And so what the jury would like to know, I think, is, so how can she look good here in this situation and have all these things you're talking about?
Yeah, that's a common myth that you can tell by looking at people who has mental illness. And probably a third or half of the people in this room have had some kind of mental illness diagnosed. But you can't just tell by looking at people, right?
You can't look like the cat lady on The Simpsons. Hurling cats at people.
And she talked about how she has a very high pain threshold. And she can be in pain, but not necessarily look like she's in pain. Because people express pain in very different ways based on their culture, based on their personality, based on their history, based on the level of support that they're having in their life. Mm-hmm. It's a highly variable thing in terms of how people experience and express pain. And so you cannot tell just by looking at someone. You have to ask them. You have to give them permission to really talk openly and honestly about their experience, physical, mental, and you have to listen. You have to be open to what they're telling you. And we all know that the best doctors out there, regardless of specialists or specialty, are the ones who are listening to us. And we get that they get it, right? We get that they get us. And that helps form an alliance, which is really crucial to all doctor-patient relationships.
Let me ask you, is Maya at any higher risk for suicide given the combination of these psychological as well as physical?
Absolutely. She has several risk factors for suicide risk. Complex regional pain syndrome. You've heard it be called the suicide disease. Mm-hmm. All right. That's because the data show very high rates of suicide in people with this disorder. She has PTSD.
This testimony's kind of weird, I think. I don't know.
Out there,
we're just going to
people
backfire.
With PTSD, they're up to 20 people a day, 20 veterans with PTSD a day.
Wait, you think it's going to backfire? Why?
Because she came across as so grounded, so awesome, so even keeled in her testimony that to say, that person they heard from yesterday is at a high risk to commit suicide.
You find that hard to believe? Did you know that the risk of suicide also goes up when you are related to someone who committed suicide? So
yeah, I know
you lose
that.
someone to suicide,
concerned.
You're actually at a greater risk of committing it yourself. So she's got two factors. Her losing her mother that way, and now
I wonder if he's going to go there next, because that would make sense. But I'm just concerned that because she came off as just absolutely so rock stable, that they're
Well,
going
but
to be
he
going,
also
yeah,
just
she didn't
he
look like that
also
to me.
he also just said you can't tell by what someone looks like or
Yeah.
how they present, which hopefully that'll get over that bar if there is. But I don't find it hard to believe at all that she's holding it together and has all these complex problems.
Because you're
I've been
smart. Jurors aren't.
Well, that's true. But I've been watching her in the courtroom concerned for her, and just she doesn't look well. Her face doesn't
Oh,
look
no,
well.
I mean, she does not look healthy, like uber healthy. And I mean, I agree with absolutely everything you're saying. I'm just concerned, like from a juror's perspective.
Just jurors
The
jurors are
average
so
juror
dumb.
might go, but she was so even keeled and like super spot on with her testimony and very powerful. And now this guy's saying, yeah, she's at a really high risk of offing herself.
Well, I'm also
I'm
glad that
worried.
she showed the jury her emotion, though. She
Oh yeah,
cried. She had, like, spurts of anger. Um, I think that was all really good. I mean, I don't know. I think doesn't everybody very funny, Valhalla. You know what? I might only be medium smart, but I am definitely smarter than your average jury member, I think.
yeah.
But no, I hope, I mean, I hope you're wrong. I hope that they
Well, I hope I am too.
understand. Well, most people though know someone with a mental disorder, and most people I think know how it's hidden, how it is
Yeah.
hidden in public. It's not exactly something you can point out. You can't tell who's got borderline personality disorder unless you're living with them every day, you know?
Yeah.
I don't know. I hope you're wrong.
Who suicide.
I hope I am
PTSD
too.
has a several-fold higher risk of suicide just alone. Recurrent major depression also has its own risk of suicide, right? And so we have a girl who's lost her mother to suicide. She has at some level a genetic predisposition to suicide. We know that there's a
That's what
heritability
you're saying. Yeah.
component
Good. You
to
mentioned
suicide and mental disorders. And then finally, she's lost a mother. She's a child who psychologically has lost a mother at a very tender age when she needed her most. And kids who lose their parents from suicide are known in the literature, and in several studies, have a higher
This is what
risk
I
of
said.
suicide. So she
Yep.
has like 5 things right
Yep.
there in terms of high risk for suicide. And that's another reason why she needs long-term
But this
good
is
psychiatric,
justification for
psychological
why she
care
needs
with
$200 million
someone or some people who she can establish a trusting alliance with.
At
because that is
least.
protected.
at
Do you
least.
have an opinion based upon your
I'd give
background,
her
training,
all the
experience,
money.
to a reasonable
I'd make
medical
Johns
probability as to
Hopkins
whether Maya
sell the
Kowalski
building,
will have
give her
one more
everything.
Yeah.
suicidal attempt or ideation through the
Like
course
the
of her
Maya
life?
Hospital from now on out. The Maya Clinic.
It's likely. The odds are in favor of that happening. And of course, we can't know any one individual, but in terms of group statistics and odds, yeah, yes.
Did it come to your attention through the course of I want to turn to Jack Kowalski for a moment. Did it come to your attention through your investigation that Jack Kowalski was being kept abreast of what was being done to his daughter at Johns Hopkins Children's Hospital during that stay? I'm talking about Kathy Beatty and
Only partially, and certainly not in the way that I would have liked to expect or have seen.
And so, do you have an opinion based upon your background, training, experience, and to a reasonable medical probability, based on the test results and your history, as to whether Jack Kowalski has some degree of PTSD?
Objection. Committee to approach on this.
All right, there's an objection. I'm looking at your comments here. Can the jury award more than the 200 million? They can, but it depends on what the state limits are. Sometimes there are limits to punitive damages, and I'm not sure. I'm looking back through your comments because somebody had said something I wanted to comment on. Where did it go? Shoot, I lost it. Oh well. Well, look, I personally think that this hospital has been negligent in this case, and I hope that they will lose. I really do. We haven't heard their case yet. We haven't heard defense's case yet. I mean, I've been trying to come up with what would I need to hear to make me think the hospital was completely innocent of all of this and everything is fine, and Maya should be given nothing. There's nothing I could hear, I don't think, at this point, because what we've already heard is just nuts. Why should nurses ever keep a child from going to the bathroom so she wets herself
Would you like me to repeat it?
or
Please.
defecates on
Do you have an
herself?
opinion based on your
Disgusting
background, training,
that
and
they did that.
experience, and from your review and
Not
review and
yet,
testing
Hot
of
Mom.
Jack
I'm
Kowalski's
going to be
knowledge of
watching it on Locals
history
with my Locals
as to whether
family
Jack Kowalski
after the trial.
has post-traumatic stress disorder?
Absolutely, I do, and he does.
And can you give the jury, although you've been in detail with Maya, but give the jury an overview of how that is going to affect this man?
Wait, now I remember what I wanted to say. One of you asked, did her mother leave a note? She did leave a note, but I don't think we've heard it yet. I think they were arguing about it during the evidentiary hearings at some point, but I don't think we've heard it yet. I could be wrong, but I don't remember hearing it.
And considering also that he no longer has a supportive wife.
It's the same kind of risk factors that I mentioned, or same kind of prognosis that I mentioned in regard to Maya, except with Jack. I mean, we know Jack was a deputy fire chief, and he responded to a lot of emergencies in his life, and he's seen a lot of death and destruction, and those are traumatic. But this trauma that he sustained with his daughter and then with his wife was absolutely, hands down, the worst trauma that he's ever experienced. And he's never had PTSD.
Objection. That's not the scope of his report.
What was it?
If you need to approach it too. Approach.
Oh boy, here we go again. Yeah, the defense is going to try everything they can to keep the information away from the jury that makes them look like assholes. But unfortunately, Johns Hopkins is asshole, and I don't see how we're going to get around that. I don't see how they get around this. They should have settled for like way more money than they offered, I guess, because I don't know. If I'm on now, one of you asked, is the jury, is it over for Johns Hopkins? No, absolutely not. It's absolutely not over. Juries are totally unpredictable. Duncan, thanks for the super chat, says, I lost 2 shipmates to suicide when I was in the Navy.
Where were
One
they?
of them was the
Please
most
repeat.
motivated, cheerful, active, and
What I'd like
social
to do,
guys you
having
can
asked the
imagine.
formal question is,
No one would have
how
ever guessed he'd do it.
Jack's PTSD,
That's the thing,
degree
you
of
just
it,
don't
how it's
know.
going to affect him, particularly in light of the fact he doesn't have Beata.
And I'm sorry for your loss,
Yeah,
Duncan. Law says.
It has affected him over the course of, it's been enormously stressful. He also has chronic bereavement, complicated bereavement.
It's my specialty,
They're living in
Spatha.
the same house that Beata hung herself in.
What's the deal with that? I mean, is that good or bad? Or what?
Well, I'm not going to say good or bad, but I can say that it's a huge reminder and a painful reminder of living with that every day in the garage, Maya going out to get in her car. She has to pass right by that place where they have a road.
Candy Kiss, yes, they
where,
did offer to
Beata
settle,
hung
but
herself.
they said,
And so
no, we want this to
Jack
be in
is
court.
really geared toward, like Beata was.
She wanted you to hear her
Jack
story.
is super geared toward raising his kids and taking care of his kids and loving them to the best of his ability. And he's really kind of in a selfless way, putting their needs above his own. And that's just kind of who he is in terms of my assessment. And Maya's getting ready probably to leave the nest at some point in the near future. And then Kyle's right behind him. And so Jack is going to be alone. And he doesn't have his spouse. And I think
And how old is he? 60?
he's 62 or 3 or something
So
like
he's not going
that.
to be hitting the bar scenes.
What's that?
He's not going to be hitting the bar scenes.
What?
Probably not.
Oh,
And so,
Anderson.
he's preoccupied. And again, PTSD keeps you
That
preoccupied.
was a
Why?
stupid
Trauma.
question.
And he's also depressed. And so
So how does that affect
Don't
his
crack a
ability
joke.
to eventually develop a meaningful relationship?
Never crack
it
a
impairs
joke,
his
let
ability
No.
alone
to
in this
socialize
case.
and
Not
get
in
out
this
and date
case.
and meet new people. And even though he has a lot of support, he's certainly not had any kind of romantic life, and he's not interested.
American
at this
Dreamer
point.
says, I could
So,
love Jack.
He's retired, and so
We'll try and get you connected.
and so
This poor guy.
PTSD, no matter what age it occurs and affects you, has negative outcome, negative implications for your health. Period. Not just mental health, but physical health, as I've explained earlier. This has been overwhelming, absolutely overwhelming, and you just don't recover from this kind of a thing.
Let me ask you a little bit about Kyle Kowalski, to come to your attention that Kyle Kowalski was there in the house at the time that Beata took her
Oh
life?
God.
And did you have the opportunity to listen to the 911 call?
I did, yes.
And did you have the opportunity to interview Kyle and test Kyle as well?
I did.
Same objection. Overruled.
And
First
Kyle
one-
also suffers from PTSD
I have
and,
to ask
depressive
the-
symptoms.
I have to ask the right question.
Okay.
Do you have an opinion based upon your background, training, and ability? Do you have an opinion based on your background, training, experience, and to a reasonable medical probability as to whether Kyle Kowalski has sustained a psychological injury, in this case, a form of PTSD or otherwise, as a result of the loss of his mother?
Yes, I do, and yes, he did.
Objection overruled.
And so, assume for the purposes of this question that Kyle stays out of the house as much as he possibly can and tries to get off to fish alone or just with a friend as often as he can, or any activity that takes him away. How does that affect your opinion on Kyle's ability to reintegrate after the loss?
Yeah, Maya's
of the
17
poor
now.
family?
Well, I think Kyle is coping in the best way that he knows how. He fishes a lot. He's very quiet and reserved, and in my view, withdrawn. He he has a very limited set of friends. He's not really involved in other activities in school. He's doing virtual school.
Poor
And
Kyle.
so I think he's very sad and anxious young man that will definitely be negatively affected. And he's lost his mother, and it was also traumatizing for him to see what happened to Maya and to see her suffer so much.
He lost his sister
So
to
overall,
captives.
this family group, when you have the interaction of all three people having these depressive, post-traumatic issues.
Yeah, me too,
What
Boosh.
does it do
Yeah.
to the prospects of?
When you and Bush were also talking about the McDonald's coffee
What
case.
people don't understand, I think, Catherine, is that
It was a
PTSD
$2.7 million
causes a wound.
punitive award, but the judge reduced it on appeal.
And she
and
never
she-
got any of it, I don't
It was
think.
like $680 something thousand it was reduced to on appeal, but then they settled out of court.
You've got to see the documentary on that, because the narrative we got as the public from the media was so wrong. She
it
was
was just a woman who
horrifically injured.
puts a coffee between her legs and hits a speed bumper gutter on the way out of McDonald's and spills it on her dumb stupid self.
It was so
Absolutely
hot
wasn't.
that it melted the nylons she was wearing into her skin. And it come to find out that there were internal documents at McDonald's that they knew that the coffee was too hot. They knew it because they had other complaints. It was supposed to have been kept at a certain temperature. It was way above the temperature that was supposed to be kept at. They knew it. They hid the information from the lawsuit. It was bad, you guys.
3 words you never want to hear: 3rd degree vaginal burning.
Yeah.
Put those words together in a sentence.
She was permanently injured. It was a permanent injury. She lived in massive pain from that moment on. A regular cup of hot coffee would not have done that. Okay. They proved it. It was the coffee was so hot that it caused this 3rd degree, and plus the nylons, now that's melted into her skin. It was bad, you guys. Watch the documentary. She deserved every penny for her crippling injuries.
And a lot more. I mean, that's what the appellate judge did. The appellate judge capped it at 3 times the actual compensatory damages. So on appeal, it was $480,000 for punitive damages for a total of $640,000. And then they settled out of court.
Not
Later.
enough. And her reputation was smeared. What do you do then? For the rest of time, everyone makes fun of her as that stupid woman who sued McDonald's because she didn't know coffee was hot.
Yep.
Idiot.
And
Idiotic.
even to the extent that people heal and get better, we know from a lot of
3rd
studies,
degree vaginal
chemical
burning is
studies,
4
brain
words,
imaging
Jeff.
studies, literally leave a scar
Now,
in the
3rd
brain.
degree is
The
hyphenated into
hippocampus
1.
is a
Oh,
part
there
of
you
it that
go.
mediates memory. and there's a high concentration of
Work on
cortisol.
it, Ben. They're done.
And I
Burn.
mentioned the stress axis. The
Third
stress-
degree
the
vaginal
response to
burn.
stress. Hormone levels of cortisol go sky high in the face of these kinds of traumatic events. And it literally kills off neurons in the hippocampus. And several studies we know show that the hippocampus decreases in size in people with PTSD. So there's literally a physical scar in people who have PTSD. And there are other neurochemical problems that we know are long lasting. And PTSD becomes biologically embedded in the body, in the brain, in the person, literally biologically embedded. Not only, that's one example of one finding that we know about PTSD. The other thing is inflammation. And we're learning more and more and more about the neurological processes of depression and PTSD, and how these mental disorders involve alterations in the brain, right? And one of the ways, and that's a focus of a lot of research currently that overlaps with the CRPS, is inflammation. And a lot of these disorders, depression, involves higher inflammation. PTSD, inflammation. And that's
Really?
thought to be the mechanism that long-term causes a higher risk of all of the leading causes of death in this country. That's how trauma and adverse childhood experiences and other traumas end up. That's the mechanism of which these traumas lead to higher morbidity and mortality. Just getting sick and dying early is what that means, morbidity and mortality. Getting sicker sooner and dying sooner.
Now, I forgot to ask you, or if I did, maybe I'm repeating myself, but did it come to your attention that Maya had tried a number of the activities and, a job in this period since the loss of her mother and had not kept up with them?
He won't even
very
look the
long.
witness in the
Yes.
eye when he
And
asks him
Is
questions.
this,
He doesn't
the
listen
juror
to
want to know,
them
well, she
either.
did try ice skating. She
if you
tried
notice.
working at Cracker Barrel. How does her history that way affect any of your diagnoses?
I think it's evidence for the veracity or the accuracy of the diagnoses I'm making is that her interest in and ability to interact in the ways that she did previously, has decreased. She doesn't play the piano anymore. She doesn't go to church much in the way anymore. She doesn't ice skate anymore. She doesn't do a lot of the activities. She's not involved in the clubs and school activities that she used to be involved in. There's a lacklusterness about her, a numbing, a decrease in her interest and pleasure in getting, involved in these kinds of activities.
She has been able to, though she has had a boyfriend.
She has had a boyfriend, which I think is really good. And she did get one job at Cracker Barrel.
Is
and that didn't last
Anderson
very
doing
long,
the
as
defense's
she,
job for
she
them?
got
I
triggered
don't.
in many different ways, and it comes back to the PTSD and the avoidance.
But she has had a
Uh,
boyfriend, so that makes
Did you see
everything
somebody
okay.
that she.
Oh
She's
my
seeing
God.
people that remind her of Kathy Beatty and other people that she
Maybe he's
didn't
trying
have
to
good
get
experiences with at Hopkins. She's scared that she's going to
it
run
out
into
there
people
before the
that
defense does.
took care of her, quote unquote, in Hopkins.
So what you're saying.
She has less energy, she has less motivation. She still has pain. And she found out that she couldn't really do all the things that she wants
Yeah,
to do
but
and
it
thought
doesn't hurt her much
that she was
anymore,
willing to
does
give a
it?
try.
Do you have an opinion based upon your background, training, and experience into a reasonable medical psychological probability as to whether both
This guy.
Kyle Kowalski and Jack Kowalski either have or show signs of major depressive disorder?
Overall, you can answer.
Yes, they're all depressed. They're all traumatized and depressed.
Do you have an opinion based upon your background, training, and experience into a reasonable medical probability as to whether Jack Kowalski has persistent bereavement disorder, complex bereavement disorder?
Yes.
And what is that opinion?
Same ruling. You can answer.
I think that he does. And again, there's a kind of preoccupation with the deceased. You can't get that person and what happened to that person and what that person did out of your mind. It becomes a kind of obsessive kind of preoccupation. And it's, there's a lot of bitterness and anger toward the loss, which is certainly somewhat understandable. And there is a lot of avoidance of the reminders. I think one thing that is evident is that Maya and Kyle, as you mentioned, take any chance they can to get out of the house and avoid the reminders. Not only does she not go to anywhere near Hopkins in Tampa, but they also avoid their own house because that's the scene of the crime, if you will. So difficulty
They need
trusting
to
others
move.
since the death is part of the criteria of persistent complex bereavement. Feeling alone, feeling like no one understands you. Confusion about one's role in life.
Your Honor, so this is
These are the criteria for
So
persistent
let's wait for our
complex.
next question.
Well, so overall, do you, for the entire family unit, what is your prognosis, favorable or unfavorable?
Unfavorable.
Your witness.
Members of the jury, I think this is a good time for us to take a morning break.
Oh, good.
Please do not discuss this case amongst yourselves. Do not do the investigation. Receive no information.
All right, let's skip on through. This is what I like about not watching trials live. It's great. We can just skip through the breaks.
He's just looking more and more alcoholic every day.
And it will be for the record, so nobody
Look at his face.
And his head.
Great.
In
In
the
his
case there was a
head.
Diagnosis of psychological factors affecting other medical conditions. Please explain this diagnosis, psychological factors affecting other medical
Mr. Anderson,
conditions.
we already did it without the doctor in our presence, so that's.
All right, Spirit Matter, you're shaming me. We have been sitting here for an hour and nobody has done even one damn squat. It's clearly time to do squats.
No, I'm watching Miss Cleavage sitting next to Roy Orbison back there.
Sorry, you got to squat.
You
Damn it.
impose fatness on you. You did it by going, oh, I want the butter on the popcorn. Oh, I want the butter on the ice cream. Oh, I want the butter on the sandwich. Oh, I want the butter on the salad. Stop eating butter. Can you just get up, walk 1 mile? Do squat! Walk farther. And if you can't walk, crawl, roll, get dragged by a goddamn forklift. Whatever is wrong with you, just move. Ever. Get off the chair, get off the couch. No one is coming to service you while you sink into that furniture, while you become one with the pleather your poor ass got on that Walmart couch. Can you try not floating into sadness? Stop eating, stop drinking, start walking, start doing anything that you haven't been doing, you fat piece of shit.
Okay, that's it. Jeff sat there the whole time. He didn't do anything.
I did because I got my
watched.
ab workout during my stream, and then 6.5 hours from now, I'm actually going to be doing squats.
Well, I squatted. Jeff is a witness.
Unless you're changing what we've discussed.
I am.
Don't say unless you are.
Oh, no, you're fine. I'm just paranoid a bit.
I guess I need to use my pronouns, the we. You. Anything before we bring in the jury?
No, you're on.
Okay, let's see.
Subtitles said, "Watch my pronouns."
Testimony regarding the PTSD diagnosis of Jack Kowalski and Kyle Kowalski, as no formal exams were ever done by Dr. Brewer.
So, of course, we continue its ruling. Let's bring in the jury. Yes.
All right,
That's
jurors
it.
coming in. Let's get a whirl.
It's diagnosed when there is a bona fide physical condition already diagnosed.
Can you tell us then how, well, I think I just asked you that same question, but how does it conflict with or contradict a diagnosis of conversion disorder in Maya Kowalski if such had actually been made?
It conflicts.
Overall, you can use that.
Yeah, they're incompatible with each other. It conflicts. You're acknowledging the presence of a general medical condition, in this case, complex regional pain syndrome, and that they are psychological factors that affect the course of complex regional. And so with conversion, it's the disorder isn't real, or it's not caused by organic factors.
Your witness. Thank you, Doc.
Liz, that's not how this works.
Good afternoon, Doc.
You cannot
afternoon.
substitute squats for
it's
a
still
deep
morning.
fried pickle. No.
It's been a long day. Okay. Good
Never
morning.
mind.
So
Here we go.
Your charges to be here today. We haven't discussed
Yeah.
this. What do you charge?
I charge $400 a day. I'm sorry, $400 an hour, and for a day, 4,000.
You were here all day yesterday?
Yes.
And did you charge $4,000 for that?
I haven't done my invoice yet.
Doctor, you're going to submit a bill.
I haven't decided. I'm going to discuss it with the plaintiff's attorneys.
Doctor, your typical charges for being in court are $4,000 a day.
Yeah.
So you have that for today.
Yes.
And your typical charge would be for yesterday as well, correct?
This is not typical. This whole experience and coming to here.
I'm getting paid $12,000 a day. So fucking what?
Yeah,
At the
so
time
what?
of your deposition, at least, you would also put 71 hours into the case, correct?
Correct.
So
Sir,
if we're doing that.
Can you, as a
that's
bald
fine.
man,
However,
tell
this
the
one
judge
says
that
you
it's
do the
over?
math. 71 hours times $400 an hour would be $28,000.
Right.
Plus the time that you prepared to get ready to come testify, correct?
Correct.
This is
So you're
such
saying we're in
bullshit.
excess of $40,000.
They always ask the same
True.
thing.
I know. It's like,
But
what are you,
when
jealous?
do
Yeah, I have a good job. I'm an
to
expert and I
testify?
make bank.
4,000 a day.
It's forensic
in the
work.
wrong
It's not
job. Me
necessarily
too.
testifying. Usually
Me too.
most things don't go to trial or into court.
I can barely make $5 a day on this stream,
Now,
Jeff.
in terms of
Today I'm doing okay.
baseline
I think I'm up to
assessment,
like 30.
you do agree there's nothing in Maya Kowalski's record before she went to All Children's Hospital on October 7th, 2016, that would count as a thorough baseline assessment of her, true?
What kind of an assessment?
A thorough assessment to see if she had, for example, PTSD for all of the medical treatments that she underwent prior to
I
going
knew
to
it.
treatments. There's no baseline assessment for that, is
I knew it. They were going to say her mom
She
gave it
had
to her.
assessment by Rebecca Johnson, a counselor.
there? Well, I'll get back to that. Well, actually, let's talk about that first, then I'll get back to my question. Rebecca Johnson diagnosed pre-existing anxiety and depression, correct?
Right. Adjustment disorder.
Okay, so just so it's clear for this jury, prior to anything that my client did or didn't do, Maya Kowalski had a diagnosis of anxiety, depression, and adjustment disorder, correct?
She had adjustment disorder with
Okay.
mixed emotions.
And you also saw, did you not, in reviewing Ms. Johnson's records, that she had anxiety and depression related to her pain?
Yes,
And that was all before she ever entered All Children's Hospital. True?
correct.
And getting back to the question I asked you, nobody, no psychiatrist, no psychologist, nobody at the request of the Kowalski family ever had a psychiatrist evaluate Maya to see if she suffered from PTSD, correct?
There was no psychiatrist that did that, but I think in the general course of being assessed for clinical care, people genuinely routinely ask about trauma. And so generally that's a gate question. And if people answer that they've had some sort of a trauma, then people ask the questions about PTSD symptoms. But there was no history given of any major trauma other than having the illness, CRPS, prior to Hopkins.
Well, you testified to this jury a moment ago about all your methodology and the
Yeah.
questions and the questionnaires that you require before you can come to this diagnosis. That was never done before, true?
This is a forensic assessment. That's correct. No forensic assessment to this detail had ever been done before.
So I understand your testimony. There is no forensic assessment of Maya Kowalski prior to her going to All Children's that you can compare with what you found, true?
It's true, but part of the forensic assessment looks at the whole life history of traumas and when those traumas occurred. And there was no indication of prior major traumas other than having complex regional pain syndrome prior to Hopkins.
Well, let's talk about that for a moment. You told the jury freely that your understanding of complex regional pain syndrome is it's a lifetime debilitating condition that deals with the most extreme pain known to man, correct?
Correct.
And you're certainly not denying to this jury that having that condition that you believe she had prior to going to All Children's is going to affect a patient severely psychologically, correct?
It can,
Okay. Well, it did for Maya, didn't it?
to some extent, yes.
Right, because it wasn't just that she had CRPS before she went to All Children's. She had been in a wheelchair for over a year, correct?
Correct.
She had gone to Chicago for treatment, right?
Correct.
She had undergone 40 hyperbaric oxygen therapies inside a chamber, right?
Correct.
She also had
That is not
over
traumatic.
60 ketamine infusions.
Oh
that
my
caused-
God.
Some of which caused hallucinations, correct?
Stop.
Correct.
This guy just tried to say that a hyperbaric chamber is traumatic. Have you ever been in one?
Yeah, I never have, but I don't need to know that oxygen is traumatic.
It's literally a comfy bed with a tent over it and this whooshing sound, and you go right to sleep. It is not.
Look what it did to Michael Jackson.
It is not traumatic at all. This is embarrassing.
And she also was taken to a foreign country and put in a ketamine coma for 5 days.
Is
Oh, Jesus
Justin?
Christ.
Oh my God, he's a racist. He's a bigoted racist against Mexico and Mexicans.
Okay, there's two ways you can present this. She agreed to go to travel all the way to Mexico for experimental treatment that was not available in America, or she was taken to a foreign country and put into a coma for 5 days.
I think he's a bigot.
Jesus.
I think he's
Come
an
on.
anti-Mexican bigot. That's what I think.
I think he's just a tard.
She volunteered. She wasn't taken. She went with her family and with informed consent and participated
I
in
should
that
be a
procedure.
lawyer.
Yes.
A procedure that a child at the age of 9 was told was a 50-50 risk of death. True?
That's what I'm informed by.
And are you telling this jury that in light of all of that, Maya had no built-in trauma before she went to All Children's? None of that affected her psychologically?
When I say trauma, I'm talking about a criterion A trauma in the DSM-5. Life is, let me finish, please.
Life is
is
full of
traumatic. And
traumas.
there's a distinction between stress and trauma. And trauma is defined best by the 3 E's. It's not just an event. It's also the experience of the event and whether there are adverse effects from the experience of that event. That's what really defines a stressor as being traumatic or an event as being traumatic.
So
And she had the support of her family. This was something they all agreed to. They went into it knowing the risk, and it has to be balanced with the intensity of her pain and the lack of response to other treatment.
Yeah, what could possibly be better for her than just to peacefully sleep for 5 damn
Right.
days?
She's going to sleep.
It could
for
have.
5 days.
let me ask you about some of the assessments that you did of Maya
Okay.
After the fact. Do you have your testing with you, Doctor?
My testimony? No.
I'm sorry.
I'm
you
waiting
have
for
your
the
testing.
defense attorney to be like, isn't
No.
there cartel in Mexico?
I'm happy to just to establish that the evaluation that you did on Maya was February of 2022, correct?
The evaluation
The date
was
of your
in,
report, sorry.
yes,
Okay.
that's right.
Do you remember having Maya fill out a score sheet on activities in the state of her health at the time?
Yes.
And she reported to you when you asked her whether she had any problems with walking, running, sports, exercise, lifting something heavy, or doing chores around the house. How much of a problem that was either never or almost never, correct?
That's what's on there. Yeah.
You are aware, in having sat here in court yesterday, that Maya Kowalski testified that she had no signs or symptoms of CRPS relapse for 6th, 7th, or 8th grade, correct?
Correct.
And so, in terms of how she did after coming out of All Children's, you are aware that she became president of her class.
Yes.
You're aware that she became president of several clubs, including Students Against Tobacco.
Okay.
You're aware that she has a boyfriend.
Yes.
You're aware that she had a job.
Yes.
You're aware that she traveled to New York
He's
City.
under the
for
impression
film
you
festivals.
cannot
Yes.
do those things if
You're
you have
aware
depression
that,
and
her plans
PTSD.
are to, I think she said her horizons for college were broadening, not just FSU or Duke, but maybe New York City for college. You heard her say that.
I did hear that.
Derp.
Almost.
Your point.
Apparently, you can't go to college, Jeff, if you have PTSD. You're not capable of doing
Her
anything.
grades were impeccable after she got out of All
Can't get
Children's.
good
True.
grades.
True.
She can't do much better than number 1 in the class, can she?
She's a genius.
From that perspective, that doesn't mean she's not suffering with a mental illness.
That's
I'm
right.
talking about her
You
functioning
mentally
in
ill
everyday
idiot.
life. She's excelling in school. True.
So,
Therefore, she doesn't have a problem.
yeah, what are
I'm
you
asking her
saying?
grades. She's
Yeah,
excelling.
she
in school.
did. She did real. She's very smart. She did well. She's persistent. Never give up.
I don't have any other questions at this time.
She doesn't actually go to school, but she
No, she's
does
been
her
in.
own courses
That's right.
and stays away from interactions other than submitting things on the internet.
This is
Correct.
basically Johns
I also
Hopkins
think that her
argument.
teachers were quite aware.
Well, she overcame
of
it,
her
so
journey
we're good.
and have been flexible with her
Right.
in terms of doing her schoolwork.
These different associations.
Just
those things
totally
where
opens up to
she
these
didn't actually
questions.
Go to anything. She just was part of the chat room.
So she's number one in her class because she's homeschooled and she's
I'm-
the only one
I'm
in
not sure.
class, right?
And so what are the 3 E's you were discussing again? Event, experience.
Event, experience, and effects.
Okay.
And
Three.
it's important distinction when you're talking about whether something is traumatic or not. We all experience traumatic events, but that doesn't mean that they're going to necessarily adversely affect us. It depends on what our experience is of those events. A hurricane, for example. Many people in this room, there was a hurricane here, and that was an event. But people had very different experiences of the hurricane and very different effects of the hurricane, drastically different. And some people were traumatized, therefore, by the hurricane, and many people were not at all, right? And that's true for any kind of trauma that there is, traumatic event, right? And so that's why it's so important to talk about the 3 E's, really as a more in-depth and full experience of what our definition of what
I
trauma
can't wait to hear
is.
what the jury
this comes
wants
out
to ask him.
of SAMHSA. This was published over a decade ago in terms of defining trauma. The Substance Abuse Mental Health Services Administration.
You think the
that
defense
oversees
lawyer's
all,
stupid?
mental health and substance abuse treatment facilities in the country. This is their definition of that.
Maya is very, very intelligent, is she not?
She is
She is nonetheless still a teenager.
correct.
Her perceptions of her life may or may not be accurate when it comes to the future and what's truly going on as a teenager.
Correct.
And the Kowalskis, in fact, did
Is she in the court today? I haven't seen her.
hire a psychiatrist to evaluate and to treat Maya, independent of anything else. Dr. Henschke, did they not?
That's correct.
Have other questions?
Nothing further, Your Honor. Thank you.
All right, now the jury's
Okay.
going to ask
Jury.
questions.
Do you have any questions?
Yeah, can we give our verdict now?
Yeah, they have questions. All right, so we're going to skip through all the mumbo jumbo up at the bench because they're going to have to fight about the questions from the jury. Oh, wow, this goes on for a long time. Holy shnikes.
Bet the defense lawyer at the end is like, we're just gonna give it a whirl.
Stop it! Don't do this to me! You know what, Jeff? I have a jaw injury
What?
because of you. I,
So sue me. You and your PTSD.
What the lawyers just went
you've
over
given me
with you. There's a couple of
PTSD.
questions that the jury has I want to preview to make sure before I make my final ruling. Here's a question. How much did you review Yada and her state of mind during
Always Jeff's
Maya's
fault.
ordeals?
I reviewed all the information in regard to that.
What specifically?
The statements in the record, in the Hopkins record about her presentation to the hospital, her suicide note, her diary entries, and some of the text.
Bush is going to hell.
I've certainly talked with Jack.
I don't know what that means. I'm not laughing because I don't know what that is. Oh no!
Exactly. Yeah, see, now you do. Now
Oh
you
yeah,
got
you're
it.
going to hell for sure.
About that at the time. I've reviewed the therapy records that on Viata prior to the,
Why is he addressing the judge instead of the jury?
Because the judge
uh,
asked the
by
question.
Michelle Rogers and
He's only
initially by
3/4
Rebecca
smart.
Johnson, who referred
I can't hear him.
to, Michelle Rogers.
What?
So a number of things I think that are relevant to her state of mind.
Any follow-up, Mr. Shapiro, on that?
Well, that's more the legal argument.
Okay. Here's the next question, Dr. Berger. The question is, do you still follow
Ginger Elaine, turn your
with
mic
Maya
on.
and her family for any follow-up sessions?
He needs
Are
to
you able to
address
answer
the
that in a
jury.
yes/no fashion?
No, I am able to answer.
He needs to address the jury on
I'm not
this.
the clinician, I'm not the doctor.
Okay. So I think that answer,
Oh, they're proffering
fine.
him right now, Jeff. The jury's not in the room.
Okay.
no,
I
the
think.
question is, do you still follow with Maya and her family for any follow-up sessions?
Oh, as a doctor. Yeah, in what capacity?
They just want to hear his answers.
I did follow up. But I'm not her treating physician. I'm not her treating psychiatrist. But in terms of evaluation for the purposes of the court, I did follow up.
Any objection to the answers that,
No, as long as he doesn't get into the substance of it.
I mean,
In light of the court's ruling, I mean, we've already made our case on it.
respectfully, his first answer was the correct answer. He doesn't follow it. And the problem is after some coaching.
okay,
No,
here's the thing. I made some rulings with respect to what can and can't come in. And so I just needed to hear what it was going to be because I want to make sure that your answers aren't going to cause a mistrial in this case. So I think it's better for me not to ask the question, and I will sustain the
When you
defense.
asked me, I assume they meant as a clinician.
I know, but it has nothing to do with you. It's just rulings I made previously in the case. So I'll tell the jury I can't ask that question. Now, going back to the other one about the state of mind,
Right. So the Dr. Brewerton was offered entirely as to Maya, her future needs, and some opinions that are excluded. There's nothing in his 37-page report that gives a diagnosis of Viata. And so this is far outside the scope of what he's been disclosed for and the scope of this opinion.
well, this question doesn't ask for an opinion, though. It just asks if he reviewed the honest state of mind. It doesn't ask for an opinion.
Right. So then whether he reviewed it or not would not be relevant to the opinion.
What?
We believe it would be, obviously.
what?
To the effect it had on
Why
contact
wouldn't it be
and-
relevant?
Well, if I allow it, though, you're still not going to be able to get any or elicit any opinion. Do you understand that?
So
Well, I
you
do.
can't.
I would ask you, counsel, for an ability to.
Someone
A
evaluated
little bit, so I wouldn't have to bring another. expert
Viata,
in,
but we can't
that's
know
not
what he
happening.
found.
It's not happening.
All right.
Okay, so
Yeah, that
I'm going to
seems
allow
fair.
the question, but there's not going to be no opinions.
Right. And there'll likely be no, well, I understand.
Okay. I will remind you in front of the presence of the jury that you're still under oath. I just kind of wanted to give you the heads up. Okay, let's bring in the jury.
I did
Remember,
notice
I have
that Irish,
11:55 hard stop.
and I'm shocked that the messy table is the defense table, considering Anderson can't get his questions right
I'll be back at the normal time.
and is so unorganized.
Since I'm chairing the meeting, I've got to be there on time.
Yes.
One would say if you're chairing the meeting, you have control.
Oh, quit joking around. Nobody cares.
See any media coverage about this case, and no one has approached you about this case. Yeah. Now, members of the jury, there's going to be some questions I can
Someone has
ask and
approached
some
me,
that I
though, Judge,
cannot.
about your hair.
And so if I do
Can we
not
help
ask
you
the
with
question,
that?
you just know that I'm not able to ask the question. Dr. Brewerton. Oh, and the same thing goes as with prior. Dr. Brewerton was outside when I reviewed these with the lawyers. The jury wants to know, in your professional opinion, does PTSD that Maya experiences result from negative events that she experienced, not the direct result of the Munchausen by proxy diagnosis?
What?
Yes.
What?
What?
diagnosis was that?
There was no Munchausen by proxy diagnosis because it's bullshit. There is someone on the jury who believes this still. The fuck? See, this is what I mean when I tell you people they do not have it in the bag. Juries are stupid and they still haven't gotten the idea that the Munchausen by proxy was a scapegoat diagnosis for a bunch of fucking morons who couldn't figure out she had CRPS. They always blame the parents.
How much did you review Beata and her state of mind during Maya's ordeals?
I reviewed a lot of information regarding that, not only the records at Johns Hopkins, but her treatment records with Michelle Rogers and Rebecca Johnson. I reviewed records from other hospitals, what they said about Beata and her interaction with staff there. I've looked at diary entries. I looked at her suicide note. I've heard audio tapes. I looked at text messages. So all of the information that I was given, a lot of it did apply to Beata's state of mind.
Next question from the jury. What are the 3 major depression incidents that you refer to?
There's one episode before her admission to Johns Hopkins that which she was getting better from at the time that she was around the time, and that had to do with her CRPS getting better. And then after the death of her mother and the hospitalization at Hopkins, there was another episode. And then the third one has to do when she relapsed in 2020, November of 2020. And those are that's the third one. And to what extent the third, overlaps with the second is not clear. But those are 3 distinct periods where she was significantly depressed.
Dr. Brereton, does Kyle Kowalski have symptoms of PTSD, anger, or depression?
Yes, all of the above.
He already
Meets
had
criteria of
answered that.
DSM-5 for
The jury's not
PTSD,
listening.
current major depression, or simply major
Not at this point.
depression. And yes, he's angry.
The next question, in your testimony, you were asked about Maya Kowalski being tested for PTSD before going to All Children's. Are you saying she did not trigger a response in later evaluations that would require a PTSD evaluation?
If I understand the question correctly, there was no evidence of PTSD prior to her admission to Hopkins. There was evidence of PTSD by other independent
After.
providers that were not privy to my evaluation. And those included Rebecca Johnson, who said that she had PTSD, and also Dr. Henschke, the psychiatrist that testified, I think, earlier in the trial. She independently diagnosed her with PTSD as well. I think that's it.
Okay. Next question, has it been brought up why they, meaning the Kowalskis, one or all, desire to reside in the home that tragedy occurred in?
I think they're certainly considering moving. I don't know that they want to stay there. I think they've been so preoccupied with the events after Beata's death and with Maya and with the trial and the lawsuit.
Yeah, try to
And
move
they have a
in
life
that
here.
time.
They've been here a while and they have a life here. And I think once this is over, they would very well consider moving. They've considered it, but for any number of factors have not done it. I think as a result, they avoid being there as much as possible, particularly the kids. But I think Jack is definitely considering getting out of the house. They want to.
The next question is, does a Munchausen by proxy diagnosis apply to the parent or the child?
Munchausen by proxy applies to the parent. However, there were diagnoses of factitious disorder for Maya. So that's an important point. In the discharge summary,
I think you've answered the question. Have you ever met Beata?
No.
Did you
I had no involvement with the Kowalskis prior to being asked to consult on this case.
have you reviewed any recordings or how many recordings did you hear by minute from Beata Kowalski?
I heard by minute. I would ballpark maybe 50 to 60 minutes, including phone calls to Beata at Hopkins, but other ones as well in terms of videos taken by the family and also exams of Maya by Dr. Kirkpatrick. That's all the ones I can think of right now.
Well, you might have answered the next question is how many videos did you review by minute?
Oh, okay.
Oh, these jurors. What does it matter how many minutes?
An hour or two, something on that order.
Okay. The next question. You mentioned that Maya Kowalski is sheltered and withdrawn. Is Maya Kowalski an extrovert or introvert?
What?
Well, I didn't
What?
formally assess
Oh
that.
my
There
God.
are certain assessment instruments to assess whether someone is introverted or extroverted. My impression,
Why
though,
is that
is that she was
relevant?
much more extroverted before going to Hopkins.
The f-
And I think that can be kind of
What's going
confused
on
with
here?
depression because depression kind of makes one more introverted relative. They're more withdrawn, more to,
I take
to
back what I
oneself,
said about the jury
less
asking
reaching
good
out.
questions
And again, part of
in
that
this
is the
trial.
anxiety
I
and
take it all back.
discomfort and fear and distrust that comes out of PTSD.
Members of the jury, I've asked all the questions that I'm going to be able to ask. Mr. Anderson.
Mr. Anderson.
I don't think I've got any questions.
No questions, sir. Thank you.
And may he be excused?
He may. I'm not going to release him at this time, but
Okay. So apparently you're still going to be under the subpoena, but you're free to leave for the day.
God
Okay.
dang
Thank you
it.
very much.
And
Okay, members
speaking
the
of
jury,
leaving
given
for the
time, I think it's
day,
gonna be a
Yeah,
good time
great
for us to take a
segue.
lunch break.
Hold on. My StreamYard just took this moment to take a dump on me and freeze.
Really?
So I was trying to
you're not
respond to you.
frozen.
Yeah, no, I don't know. I don't know what's going on, but I can't move around my screen. Anyway, speaking of taking a break, what's going on here, Jeff?
Time to go to sleep. It's 2 a.m. here.
Yeah, you look tired. It's time to go. And hopefully I'm so shocked you're here. I thought you were going to be like, retching over the commode after the whirl, the little whirl drink that we did
Yeah, I
earlier.
think that things have calmed down a bit internally. That was
That's
bad,
good.
Bad drink.
Well, thanks for hanging out.
Yeah.
Yeah.
We'll do it again.
All right. Take care, Jeff.
All right.
Wait, what's next? What's next for you? You got something coming up on Friday, right?
Well, tomorrow we're going to be doing more Depth v. Heard. Hopefully you're available for that.
Yeah, I'll be there.
Probably the last or second to last day. We'll be doing that Thursday.
Unless we start it all over again with puppets.
Yeah, that's possible. Thursday is O.J. Simpson trial chill stream with Chandler Remington, the co-host for that. Friday morning U.S. time, YNW Melly double murder trial motion to dismiss. That's going to be crazy if the previous motion is any indication.
Oh,
And
when is that?
Friday night-
What day is that?
Friday morning.
I want to be on that. Can I
Okay.
be on that with you?
You can.
I want to watch that. I watched those.
All
Oh my
right.
God, I have questions.
We all do. It was a rough, interesting hearing. And then Friday night U.S. time is my effort Friday. Grifty,
Excellent.
drunken boozathon.
Excellent. All right. Everybody, remember to set your alarm clocks for all of those things that you just heard. All
of
the
it.
things. Thank you,
All right.
Jeff.
Yeah, I'd like to say enjoy the afternoon of this, but
There's no
enjoy is
really
kind of a weird
enjoying
thing.
this.
Yeah.
Yeah. I know.
All right. Well,
Take
care,
care,
man.
Jeff.
See you tomorrow, I hope.
Okay. See ya.
Bye, chat. You guys rock. Give her money. Bye.
Speaking of money, Duncan Naito sent a $5 super chat, says he's trying to grow out Hair Island trademark so he can turn it into a spiraling comb over. Perhaps. And then I think Duncan sent another one we missed here. This is an easy answer. Which Harry Potter character would Maya Kowalski be? Obviously, Luna Lovegood. She's the ethereal looking blonde who had all these tales of conspiracy and nobody believed her. But it turned out it was all true. So obviously, she's Luna Lovegood. All right. Let us continue.
Oh,
Oh,
I'm just think through the time for a second.
wait, that was supposed to be a mock jury question. It was still kind of a fun question, though. But yes, this is exactly the sort of thing that these jury questions are starting to be. Is Maya an extrovert or an introvert? Like, what is this? 20 questions? What the hell, people? What the hell? Boosh says, nerd. Yeah, I know. I know all those books.
Let's have them ready to go at 1:15.
All right, so they're
Have a
on
wonderful
break.
lunch.
Oh,
Do
no.
not discuss this case amongst yourselves. Do
Jesus.
not do any investigation and receive.
Oh no, you guys, we might have caught up with the live stream. We did. So you know what that means? That means I'm out of here too. Because they're still on lunch and I've got stuff to do. I've got to go and do my I don't know, laundry. I've got laundry to do. I've got vacuuming to do. I can't just sit here through lunch and just, rap with you guys. So I'm out of here too. Good timing. If when they come back, maybe I'll come back, but probably not. I like to come back after it's been over so I can fast forward. I can't believe we caught up to the live, but we did. What sign is Maya? Yeah, what other stupid jury questions can we come up with? Did I stream Maya's testimony? I sure did. Yesterday. So you can go and watch that on my channel. But yeah, okay. 2 hours is good enough. All right, don't forget to tune in tomorrow to Legal Vices, Johnny Depp Sidebars. We will be doing that tomorrow at 9 a.m. And then, I don't know. And then I'll probably do whatever I missed today after that. So we'll see. All right, guys, I'm out of here. And I think I will leave you with something that will make you laugh. And since we are in a trial, I'm going to leave you with objection hearsay.
I used to be respected, people took me at my word. Then I became a lawyer representing Amber Heard. Objection hearsay. Oh my God, I don't have a case. Objection hearsay. Now I'm ashamed to show my face.
Well, I'm a famous movie star, yeah, life is always fine. I sit down at my penthouse drinking mega pints of wine.
Objection hearsay.
I don't know why we ever wed.
Objection hearsay.
Who the hell poops in someone's bed?
I object to everything, I may have an infection. Cause I say I object, the judge says
That was your own question.
objection hearsay. Court isn't supposed to be this hard. Objection hearsay. How did I ever pass the bar? Well, just one final question, sir, and this one has been prepped. What is your name?
My name is Johnny Depp.
Objection hearsay. How can you prove that that's your name? Objection hearsay. Looks like we win and you